Welcome to Suite 250 at Cool Springs Foot Care. I'm Dr. Lance Reeves, and today we're going to be talking through what to expect after a minimally invasive bunion surgery. There are a lot of people who are worried about bunion surgery because they've heard the recovery can be so tough. I'm hoping to shed some positive light on that recovery process. Because my bunion surgeries are done with a minimally invasive technique, this means that the incisions are only 2 to 3 millimeters. This also means that I don't use hardware, I don't use pins, screws, plates, anything like that. So the surgical footprint is smaller, less invasive, there's going to be less scar tissue, less swelling, and less pain for that post-operative recovery process. First, let's talk about how much time you're going to be off your feet after this minimally invasive bunion surgery. You are going to be off your feet for 0 days after this surgery. That's right, I said 0 days. My goal is to get you walking out of the operating room on your own 2 feet. I think this does a great job in decreasing atrophy and speeding up the recovery process for patients. Now, it's important that patients decrease the amount of activity after this surgery, but any activities that are required for daily living, such as using the restroom, getting food, or small errands are all allowed. Next, we can talk about what you'll be wearing on your foot. Some patients come to me concerned about wearing a cast because they've heard negative stories about them. I choose to never put casts on patients. You will either be wearing a walking boot or a surgical shoe throughout the post-operative course. When deciding if a patient gets a walking boot versus a surgical shoe depends on several factors. First, if it's a more extensive procedure, they're more likely to be in a walking boot. If it's a less extensive procedure, they're more likely to be in a surgical shoe. Another factor is if patients are already unsteady while walking or they're a fall risk, then I'm more likely to put them in a surgical shoe versus a bigger, bulkier walking boot. Ultimately, my decision between a walking boot and a surgical shoe depends on what I feel is going to give the patient the best outcome from their surgery. The length of time that a patient is in a surgical shoe or walking boot mainly depends on what type of surgery they had. Again, a more extensive procedure will be a little bit longer. A less extensive procedure will be a little bit less time in that surgical shoe or walking boot. Patients can be in a surgical shoe or a walking boot for as little as 2 weeks before they get back into a comfortable walking shoe, or they can be up to 4 to 6 weeks before they transition back into that shoe. The main thing that can prevent a patient from getting back into a shoe is the postoperative swelling. Once that swelling is controlled, patients are usually able to get into a shoe pretty quickly. Pain is another common concern about patients thinking about bunion surgery. Again, because this technique only uses 2 to 3 millimeter tiny incisions, your pain is typically going to be much less than a traditional open surgery. A lot of my patients can get away with just Tylenol or ibuprofen for their post-op pain. In some cases, patients will need a stronger pain medication, but rarely have I ever prescribed that for more than 1 week after a post-operative bunion surgery. Obviously, everyone's pain tolerance is a little bit different, but that's why I like to keep a close eye on my patients throughout their entire post-operative course. For the first couple weeks, rest is going to be important after this surgery. So when you are resting, elevate your foot. You can ice the surgical area for 15 minutes per hour. Especially since patients are able to walk after this procedure, it's going to be more important that when they're resting, they do elevate that foot. As far as patient follow-up, I like to see patients 3 days after surgery. And after that first visit, I prefer to see patients once a week for the first 5 weeks after their bunion surgery. Personally, I like to keep a very close eye on patients after my procedures. This allows me to stay in tune with everything that they're going through as they're recovering from this surgery. I also like to do all of my own dressing changes. I want to be the one taking the dressing off, looking at the incision, and reapplying the dressing every single time for that patient. I don't want that patient to be burdened with changing their own dressing at home because they took the time and they trusted me for their surgical correction. I want to take the time and make sure I'm giving them my full attention and my full effort to perform those dressing changes for them. As the days pass, you will be gradually returning to your normal activities. This will be determined by several factors. First one is radiographic healing. Things need to look like they're getting better on x-ray. And clinical healing. The incision needs to be healing and the postoperative swelling needs to be coming down enough so you can get back into normal shoe gear. Once that is the case, you can get back into normal activities slowly, meaning you start small and gradually work up back into that normal range of activities. This is going to be different for every patient, and it depends on what activities were normal prior to surgery that they're trying to get back into. For a high impact activity, that may take a patient a little bit longer, but if it's a low impact activity, then patients may be able to return to normal fairly quickly. Physical therapy is always an option for my postoperative patients, but that is usually determined after a discussion that I have with the patient. If a patient feels like they would benefit from therapy, then I'll work really hard to get you into the best place to help with your recovery process. On the other hand, if a patient feels like they're recovering well and they don't need physical therapy, then it's not something I require of my patients. Let's recap some of the highlights after a minimally invasive bunion surgery from myself. First, you'll be walking day 1 in a surgery in a surgical shoe or walking boot. Second, there's a good chance that Tylenol and ibuprofen is all you're going to need to take after this surgery. Third, I will be the one and only person doing all of your dressing changes and post-operative splinting and seeing you every single time you come to the office for a post-op visit. And lastly, you get peace of mind that I'm going to be with you every step of the way, no pun intended. If you have any questions about minimally invasive bunion surgery, or if you feel like you may be a candidate for that type of procedure, please call the office at 615-567-5622 or visit us online at coolspringsfootcare.com. Thanks so much for watching this video. If you found it helpful, please like, comment, and subscribe to our channel.